My name is Clark Cunningham. I'm the co-director of Pancreatic and Hepatobiliary Surgery here at St. Agnes. I went on to medical school at George Washington University. From there, I went to do my general surgery residency at the University of Maryland here in Baltimore. During that residency, I spent 3 years at the Johns Hopkins University, where I was in a laboratory studying pancreatic cancer at a very basic science level. In addition, I was working with several surgeons there on a more clinical level to study both pancreatic, biliary, and gastric cancer. After that research fellowship was done and my residency in general surgery was completed, I went back to Johns Hopkins to do my clinical surgical fellowship in pancreatic and hepatobiliary surgery. And from there, I've come here to St. Agnes, where I'm very happy to be. One of the greatest assets of St. Agnes is that we can offer world-class surgical treatment for difficult diseases like pancreatic cancer, but in the warm, comforting, supportive environment of St. Agnes Hospital. Pancreatic cancer is one of the worst cancers you can get. Just 5 years ago, the number of patients who were diagnosed with pancreatic cancer was about 32,000. And unfortunately, the number of patients who died of that same disease was essentially the same number, 32,000. In 2010, the number of patients who were diagnosed with pancreatic cancer was increased up to 43,000, but the number of patients who died of the disease was decreased, only 37,000. Now, while that isn't a great success, we are making strides in the treatment of this disease. I think in the future, things that we can look forward to from pancreatic cancer is not only continued good outcomes from resection of the disease with the Whipple operation and other pancreatic resections, and better treatment with chemotherapy, but beyond that, more targeted therapy like we now do for some other cancers.